Hi everybody, it's Dr. Matthew Hertert here again with Centre Chiropractic in Boalsburg, just outside State College and Penn State University. And today what I want to talk to you about is the Gonstead technique of chiropractic. In chiropractic, when we say technique, really what we're describing is a different way or a systematized way of analyzing the spine and joints and locating misalignments and then how those misalignments are corrected, different ways of doing that. And there are a lot of different ways of doing that. I think there are at least 150, if not closer to 200 named techniques for doing that in the profession. And a lot of people, once they graduate from school and get out and practice, they combine one or two. One of the things that's different about Gonstead and a couple other techniques is that we don't stray outside the technique. We really just do Gonstead technique. When you follow a system, you get better results, and if something's not going right, you can better evaluate how to course correct. So while there are a lot of different systematic and diagnostic and treatment differences between Gonstead and other techniques that make Gonstead unique and more effective, in my opinion, there are really three things I think most people associate with Gonstead chiropractic, or that I think are important for you to know about here today. The first is the cervical adjustment, the way the neck is adjusted. That's very distinct and unique to Gonstead chiropractic. The full spine x-rays, radiographs, the films that we take, and then inter-examiner consistency, meaning the consistency between Gonstead doctors that you'll see one place to another. Everybody's really doing the same thing. So that neck adjustment, the cervical adjustment, really what we're focused on is restoring the proper biomechanics of that joint, trying to get the joint back in place so the soft tissues can heal and hold the joint in its proper position. And the way Gonstead, Clarence Gonstead, who developed the technique, designed this or evolved this technique is really designed to give you the best adjustment biomechanically, to adjust you in a way that's best for the body so you can get the most out of each adjustment and heal as quickly as is possible. Now, there are a couple other nice things about it. Really, what we're trying to do is pick that vertebra up, lift it forward, and set it back up on top of the disc. You know, most vertebrae have discs between them. We're trying to lift it and set it back up on top of that disc. The primary pathology, the primary problem with misalignments in the spine is that vertebra dropping back and down off that disc. It can't really get out of place rotationally or wedging. It can't really get out of place in those two planes, or the Cartesian plane, without first dropping back off that disc. So what we're really doing here is trying to, first after we've located the vertebra that needs to be adjusted and figuring out which way it needs to be moved, we're contacting that vertebra from behind, we're stabilizing the neck in the front to keep the rest of the vertebra from moving, and then I'm lifting that and setting it forward while taking out the rotation and the wedging. So if any of you have been adjusted by a chiropractor before, or if you've seen it in film or TV, you're probably wondering, well, where's the rotation? You know, because you're kind of used to the idea that you see a chiropractor, they're going to do this twisting thing in the neck. Not only is that not the most effective way biomechanically, but it's also can cause more injury as part of the adjustment. Not that they're dangerous adjustments or that cervical adjustments are injurious in any way, but every adjustment is micro-trauma. You're tearing scar tissue, you're moving anatomy. So our goal, our intention really is to get you the best, most effective adjustment so you can heal as quickly as is possible without, you know, causing, we want to cause as little micro-trauma as is possible in the meantime. We want to treat everybody like they're our grandmother. So not only can that, I mean, that rotation really just kind of, it doesn't lift the vertebra back up onto the disc, you're just kind of spinning the vertebra around that primary problem, which is the posteriority, the dropping back and down of the vertebra. So it's easy to make a cracking sound, but you're not necessarily fixing the primary problem in the joint there. So in addition to that, when you rotate and then deliver that little thrust, the direction of the thrust is following the direction of the fibers and those big ligaments around the outside of the disc, so it's easier to injure those ligaments to some degree. So it's really designed to be the most effective. It's actually far more comfortable, according to most of my clients who've been adjusted in another fashion. And if you have any more questions about this, I encourage you to go watch the video we've produced on adjusting the spine. You'll get to hear me talk more about it. I'll probably say some of the same things, but you'll also get to see my friend Angie get adjusted, so you'll actually get to see what that looks like, about as close as you're going to get to the experience of it without actually coming in. So the second thing really are these full spine pictures. They're actually very low on the radiation exposure. You get about the equivalent of 2 hours in the sun or thereabouts. You get less radiation exposure than you would if somebody took sectional views of the spine, the cervical, the mid-back, and the lumbar, because you have overlap of the images in that case. And we get a lot of really important and specific information about this. Gonstead does a very specific analysis of leg length differential, left and right, more accurate than anything else I've seen in healthcare in terms of how people try and assess that. There's a very specific assessment of pelvic asymmetry. We get to look at things like scoliosis, that abnormal side-to-side curvature. We get to look at normal healthy postural curves and see how they're doing. And of course, we also get to see, most importantly, we get to see very specifically the direction of misalignment once we find one on your body. Might be hard to believe or hard to fathom, but technically there's a huge difference. So pretend you're looking at a back here and these are two vertebrae on a disc. If a vertebra drops back and down and then rotates to the left and then wedges up on that side, it's a completely different adjustment than if it drops back and down, rotates to the left, and wedges up on the right. You actually stand on the opposite side of the client. That's how different that adjustment is. So being able to see in a really specific way what's going on with the alignment does make a difference for a lot of people. Some of these anatomic structures back here are the most commonly misshapen in the spine, so it can be easy to misinterpret the direction of misalignment without films. Most chiropractors obviously are doing a great job with that, just like with the cervical adjustments. I mean, there are thousands of chiropractors out there getting people better with rotation in the neck. They just might be causing a little bit more micro trauma. There are lots of chiropractors who help people without these films, but these allow us to help get you more specific adjustments so you need fewer and you get better faster. The other thing that's important about these is we take these in a weight-bearing position, meaning with you standing. Most of you, if you've ever had an x-ray, you probably had it taken laying down with very few exceptions. And it's not that that's a bad thing, but if you're looking at biomechanics, so let's say you throw out your low back and you go to the ER, right? And they want to take a picture, one, because they want to make sure you didn't fracture anything, but they're trying to look to see if anything is obviously out of position. If they have you lay on your back, not only do you not have kind of the normal standing posture to look at the relationships between things or to look at the leg length difference. I mean, you could have an inch leg length difference and that wouldn't even register if you were laying down on your back. Not only that, but if you've hurt yourself that badly, you're probably in what we call an antalgic posture. You're probably standing funny to try and take pressure off the area that's injured. If you're laying down, you're going to be able to do that to even a greater degree because you don't have gravity in the floor forcing you into a more proper position. So we get a lot more accurate information off this. We've had a couple clients come over years who've recently had pictures of their low back, and I say, well, gee, we'd really like to take pictures in here because we're going to get better information about this. Now, the third thing has to do with that consistency from one Gonstead doctor to the next. I felt a calling to chiropractic. I got very clear internal information. This is what I was to do next, and I was a decade older than most of my students and the other students I was in school with. I was really devoted to this, and part of how I respected that or acted on that devotion was I went to visit over 100 chiropractors over my first year and a half in school. I wanted to see how they ran their offices, how they evaluated and treated people. I wanted as much of that stuff understood so when I got into practice I could just put that in place and really focus on taking care of people. And one thing I noticed, what really drew me to Gonstead, was everywhere I went in this country, Gonstead practitioners did the exact same thing. Every office to office is the exact same thing. Same physical exam, chiropractic exam, same x-rays, same way of marking the x-rays, same way of assessing where the misalignments were, same way of correcting them, the same way of adjusting. It's the exact same thing office to office. The only variation I really ever saw was if and to what degree there was any sort of physical therapy being done. Some did stretching exercises, some didn't. Some had a massage therapist in the office, some didn't. The chiropractic part was exactly the same office to office. And as a science-minded person, that really spoke to me. I mean, it seemed really reproducible, it seemed really consistent, it seemed like it was a system. So if you've got that kind of system in place when things aren't working out well, it makes it easier to identify that sooner and course correct. So that really spoke to me and lent a lot of credibility to the Gonstead technique in particular. So there are a lot of other differences we could talk about with Gonstead. I mean, we use an inflammation meter that most techniques don't use to look for swelling around the joints. It's pretty uncommon to get more than 3, 4, 5 segments of the spine adjusted when you see a Gonstead chiropractor. I don't know about you, a lot of the chiropractors I saw in my life would kind of twist shoulders and hips in opposite directions and try and make everything crack. We want to be really specific and just adjust the joints that need to be out of place. So there are a lot of other things I could go on and on about. But those are really the essential ones that really, I think, distinguish us from other techniques and are good for you to know about as a potential client. Clarence Gonstead still fascinates me. As a young man, he had rheumatoid arthritis. He experienced excruciating pain, and the only place he ever found relief, he said, was with chiropractic and seeing a chiropractor. So after the war, he went to chiropractic college on the GI Bill. He opened a small office over a bank in Mount Horeb, Wisconsin, which is a small farming community, and continued to dissect cadavers at the local university and made a lot of discoveries based on that. Actually, my understanding is he was responsible for some changes in Gray's anatomy, including things about the SI joint down here based on his cadaver studies, and of course he evolved the technique based on that as well. He was so successful at what he did that within a couple years he needed to move out of that little office into a big office down the street, and a couple years later he built an 8,000 square foot clinic with a hotel and an airplane landing strip because people were coming to see him from all over the country and from other nearby countries because he was so successful at helping people. So a great inspiration to me and to other Gonstead chiropractors. I don't need to go on at length about him with you. Suffice to say that I'm really glad he was in the world and gave us this work, and I think most of my clients are too. So if you have questions or comments, you can post them below this video. I will check back from time to time and address those to the best of my ability, or you can email me at the office, or you can call me for a free, no cost, no obligation consultation. Even if you're elsewhere in the country and you're trying to find a Gonstead doctor, I'm happy to help with that too. Whether you're in pain or trying to get out of it, I think you'll be glad that you did. And I want to thank you for your time today and extend blessings to you and yours.